REDUCE-IT trial, presented here at AHA sessions in 2018, looked at high-dose omega-3 fatty acid supplementation on top of statin therapy in patients with cardiovascular disease or with high risk for cardiovascular disease and having triglycerides in the range of 150 to 500 milligrams per deciliter, so moderately elevated triglycerides. In this trial of 8,000 patients, they actually assessed high-dose pure EPA, that's eicosapentaenoic acid, therapy on top of statins to see whether that would reduce cardiovascular events. What they found over approximately a 5-year trial was a 25% reduction in cardiovascular disease event rates and a borderline significant reduction in total mortality of interest. This is one of the first trials that's looked at high-dose pure EPA on top of statin therapy in patients at high risk for cardiovascular disease, and certainly one of the most positive using any type of omega-3 fatty acid. I think this opens the debate again about whether is it just the EPA and is it just the high dose that will matter for reducing cardiovascular disease events. I think this is a very well done trial. We need to worry a little bit about some of the adverse effects. There was excess atrial fibrillation, for example, but that was more than swamped by the beneficial effect, showing a 5% absolute risk reduction over the 5 years of the trial, with a number needed to treat of about 20 patients over 5 years to prevent one major cardiovascular event. So a very interesting trial, and I think this reopens the debate about fish oil on top of statins, but it looks like it needs to be higher dose and perhaps purer forms of omega-3 fatty acids.